So hello Gary, thank you very much for joining us today. So am I right in saying you're the area manager in Northern Ireland for Practice Plan?
Yeah, indeed. Have been for the last 5 years, but have been involved in the dental plan industry for 23 now. So
23.
yeah, seen some changes
Yeah, I bet, particularly in the last few years I can imagine.
more than ever. Yeah,
So Northern Ireland, I think I mentioned this briefly before we started, is obviously an area that we cover but perhaps don't see as much of as we'd like. So it'd be really interesting to see today what the dental landscape is like over there and where you might think it's heading. So what is the dental landscape like at the moment?
sure. It's chaotic, I think would be the right way to describe it, Gabby. It's pretty much the same as the UK in terms of the demand is outstripping supply, but the demand's not just outstripping supply in healthcare dentistry, what I call the most basic restorative care.
Mm.
It's outstripping demand or supply in cosmetic dentistry, it's outstripping it in implant dentistry.
Mm.
It seems to be that every facet of dentistry is just there's just not enough hands to cope with the demand of that. Um, we're also seeing over here more and more dentists are moving independent, but they're not moving for financial reasons. They're moving to try and cope with the demands of their patients and the increased demands from society as a whole.
Mm.
I mean, if you have 3,000 patients on your list, and each of those patients needs 3 hour long appointments every time you see them,
Mm.
you simply haven't got enough man hours to cope with that demand, and the patients are then obviously irked by that, and practices are having to try and reduce that demand somehow. So we're seeing more and more dentists moving into the independent sector over here. We are seeing associate dentists moving from their NHS job and
Mm.
into an independent job. Again, that's not for financial reasons, it's to do with literally the quality of care that they can provide
I see.
for a set number of people.
Mm.
And then there's a trend that I've been seeing for quite some time now, and that's where 20 years ago a dentist came through dental school, BDS was result.
Mm.
They went on and practiced dentistry in a general practice for 30 years and retired. Whereas you're now seeing so many different facets of dentistry. You've got your align and bond market, you've got your implants, you've got your facial aesthetics, your digital smile design, your snoring solutions. So young dentists are now moving faster into those facets of dentistry. But that's creating a global shortage again in what I call the healthcare dentistry market.
Mm.
That dentists more and more are focused on their, I suppose, facet of dentistry or their area of special interest.
Yeah.
So that's causing a lot of change within the dental landscape, and I can't see how that can change back to the good old days, I suppose, of the dentist came out, practiced family dentistry and retired. So
Yeah.
I think the landscape's probably changed forever.
Yeah, yeah. No, I agree. I think what you mentioned there is more that aesthetic side, I guess, of dentistry is becoming a lot more appealing in some ways. Obviously, among other areas too, but there's definitely been a push of that, and I think
Yeah,
COVID sped that change up. But I think you're right in that a lot of graduates are coming out of dental school, and rather than focusing on perhaps more general dentistry, they are looking already at what they'd like to specialise in and completing the relevant masters and courses.
yeah.
Sure. I mean, there is obviously a good side to that as well. Do you think there are some positives among?
Yeah, I mean, my advice to dentists to have a career and longevity in your career is find what facet you love.
Mm.
Because if you're being honest, if you just go in and do what healthcare dentistry for 30 years and retire, it's almost like a bit like a production line,
Yeah.
where you're doing the same thing day after day after day. Whereas to gain longevity in your career, you really have to sort of find your niche and find your area, and that allows you to still practice some form of healthcare dentistry, but also it allows you to gain personal satisfaction from whatever facet you enjoy most. So yeah, it's not a bad thing. It's just that is having a massive impact on the numbers of dentists who are providing general care.
Yeah, for sure. I mean, obviously, you said at the beginning here that you've been in dentistry and working within dentistry for 23 years. How has this changed what you do? How has this changed your role?
Wow, massively. If you go back 5 years, 10 years, my role was to try and help grow businesses
Mm.
and help them market, help them communicate, help them grow their plan numbers. Whereas now it's more of a mental health role that you're almost trying to help dentists with the problems that they're faced with day in, day out and weekly. You know, one of those major problems as well is hygienists. We in Belfast haven't had a hygiene school in Queen's University for over 10 years now. So that's over 10 years where the output of hygienists hasn't happened.
Yeah.
So the shortage of hygienists have been increasing and increasing, but now we're in the perfect storm where more practices moving independent. They recognise the need for hygienists, but there simply aren't any out there. So that's having a major impact on the time management for dentists, because dentists are then having to put a lot of that perio work back into their own diary, which isn't best for them, because at the end of the day, dentists are trained to cut and repair teeth.
Yeah, for sure.
And hygienists are trained to do the perio side better. So it is better that patients, if they're in an independent marketplace, see a hygienist. So that's another situation that you know, it doesn't really have a short-term answer.
Yeah, no, I agree. I think there's a massive conversation happening at the moment, which is utilising hygienists and therapists to the best of their ability. Basically, you know, they're so skilled and they can actually take a whole bunch of work away from the dentist, so that the dentist can focus on what you just mentioned there, perhaps more complex procedures that hygienists don't have the training in. So it's a shame that hasn't been the case, because it feels that that's going to be a problem that continues for the years to come if there isn't any training taking place in Belfast. Yeah,
it is. And you know, for a young nurse to pack her job in and head across to England for 2 years to do her hygiene course, it's a big risk for any young person to go and do that, and the resultant costs with that. So very, very few, if any, are moving across to the mainland to do their hygiene course and then coming back.
Oh, no, I mean, why should you have to either? I think maybe perhaps growing up in England, I take it for granted that it is unfortunately where it's the hub of a lot of activity in a lot of areas. So when it comes to university or training, you don't have to sort of up and leave your family and friends and literally get a flight across the sea to do so. So I can completely see why that's not a massive appeal, particularly with the state of how things are heading at the moment. It's so expensive.
And you know, if you were doing your hygiene course, you can still live at home in Belfast, you can still get a part-time job, you can even do some nursing in the Royal School of Dentistry to try and supplement that. But if you've got to leave your paid job to go across the water, pay for all your costs, it's not so attractive these days.
No, even if it's a lifestyle that perhaps has an appeal, sometimes it just financially just couldn't happen for a lot of people, I can imagine, which is a real shame.
Yeah, and the other thing about that is most hygienists work in the independent sector, and that really is adding value to an independent practice. If you've moved from an NHS style of dentistry and a style of care, and you're moving through the gears, as it were, in an independent practice, it's added value for the patient. You know, the first, the second, the third, the fourth time they see a hygienist, it really is added value, and they do appreciate it. So if Northern Ireland is having a problem with that, then you know, it's how do you add value to the independent journey?
No, definitely. I know we're also going to speak about time management today, which obviously is particularly important in a climate where well, we don't have a lot of it, and especially dentists and dental team members, they've got a backlog to handle, and they've got to get through it and meet the demand that there is at the moment. So what's your kind of outlook on the time management side of things? How can
I think from what I can see, time management has gone completely and totally out the window. I'm a firm believer of everyone has a plan in life until you get punched in the nose, and that's basically what has happened. COVID has been the punch in the nose for dentistry. Previous to that, many of the dentists, if not all of the dentists I work with, would have had zones in place for new patient clinics, zones in place for their implants, their orthodontics, where they had focused zones for those specific treatment types. Since reopening 2 years ago, that's completely gone, and it's almost been in firefight mode. And I personally feel that the firefight has to stop somewhere, and the practices have got to get back to diary zoning, because at the end of the day, there's no one wants to see a new patient having just had a series of ortho extractions on teenagers, because you're not really in the best place to deal with that new patient after you've just had 2 ortho extractions for teenagers, or an endo that's gone wrong and you've had to do a surgical extraction. So I think we've got to get back to those zones, but to do that, dentists and their teams have got to take time out to just stop what they're doing and have a look at this, because the common theme that I hear week after week month after month is I'm too busy, I'm just too busy, and my appointment books are getting longer and longer and longer. And my advice to them all is, well, you've got to start somewhere. You've just got to stop, have a look at what you're doing, what's working, what's not working, and as a team, sit down and redesign your plan. Because like I said, everyone had the plan before they got punched in the nose.
That's true.
And I think that's what's happening, plus the net effect of all that perio work, or a proportion of that perio work having to go back into the dental diary, is having a major issue on profitability.
Yeah, I bet.
Which short term is manageable, long term is a problem.
Where can practices start then? What would, if you were speaking to somebody who perhaps manages a practice or a dentist within practice, and they're struggling to kind of take this time away and have a look at what's going on and what they've got to deal with, where can they start? What's the best place to begin?
I think the biggest problem has been brain fog. That and everyone's bandwidth, their mind is sort of full up at the minute.
Yeah.
That they can't take anything on board to literally just say, right, something's got to change here. It's just got to change here because this is not working. And I was reminded recently of a quote by C.S. Lewis, which was, isn't it funny how day by day nothing changes, but when you look back everything is different? And I think that's where dentists currently are. But it is simply a matter of, you've got to look ahead in the diary, and if you're booked for 8 weeks, in 8 weeks time you've got to clear a complete day out of your diary. You've got to sit down with your team to chat through welfare for their team as well, because they're the most important people in the business. They provide the care, and I think what they've got to do is sit down, look and say, what's working, what's not working, what did we do pre-COVID, what was our patient journey like pre-COVID, and what's it like now. And I think that would be the number one piece of advice that I would give to any practice. And yes, I still hear the comments of, but we can't, we're too busy. Well, you've simply got to start somewhere on that. I also think that practices have got to recommence their communications, because it's wrong to assume that your patients know what's going on in your world. Whereas if patients know that you're currently booked 8 weeks, 9 weeks, whatever it is, and that is purely down to the pent-up demand of treatment need of existing patients, then most patients will be fine with that. If your patients are made aware of the number of people that you've managed to help in the last 2 years with their dental needs, people are more empathetic to that. If you're, it's a big bold statement to say we've managed to help over 1,000 people with their dental needs since we reopened. We're proud of that. That's a really bold, positive statement. But practices are scared to communicate with their patients in case they get a barrage of abuse. If it's done the right way, I don't believe that you'll get that. You know, you've got your newsletters, your e-newsletters, or newsletters, e-signs. You've got your internal TV screens. You know, these are all messages that you can communicate to patients. Whereas when the patient rings up for that first appointment, and they've been an independent patient for many, many years, and they're told it's a 9-week waiting list, there's that barrier instantly there. So I think practices have got to start that communication. And another observation from the last few weeks, the world's sort of missing community. It was probably quite obvious in the recent weekend with the Queen, and everybody sort of did come together in communities, and I think communities are now dispersed and displaced. So I think if a practice does get to be back to the heart of the community, I think there's a big win in that. Now that might be that through local events, through supporting local charities, through doing something that enhances community spirit. But I think that there's a big win to be had in that one, by practices doing something back for the community. Probably another thing that's suffered as a result of the last 2 years has been learning. I'm a firm believer of boredom begins at the end of the learning curve. But I think over the last 2 years, Zoom learning and online learning isn't the same. It's not the same as going and meeting your community of dentists, your community of nurses, you know, your community of local practices. And I think that practices have got to take the time out to actually look at their own CPD, their own learning, and say, right, what is it that we stopped doing? What is it we want to learn more of? And start to focus on that positive side of things of, right, I need to get back to my CPD, I need to get back to my learning, I need to get that back to face where I have a coffee with someone and learn more than I learned on the entire course.
Yeah.
So I think there's that. And like I say, that the knock-on effect of that is obviously boredom.
Yeah. Obviously not.
So that would be what I would do. Another thing that I would probably look to advise clients on is make exams less boring. Because if you ask any dentist and they had a day full of exams, do they like it? The answer is no.
Yeah.
And it's because it's mundane, move your tongue from side to side, left to right, you're okay. It's the same repetitive thing, whereas we now live in a world where technology is now commonplace in a dental practice. Photography is now commonplace in a dental practice. Why not try to implement a 16-point health check where you go through 16 points of the patient's mouth? Why not bring photography in annually into their examination? How many patients know the shade of their teeth between a scale of 1 to 16? These are all things that will make the examination a little bit less boring and a little bit more interesting.
Yeah.
And it's delivering that added value for the patient, which is what independent dentistry is all about.
That's true.
Yeah. So those are the positive things that I would try to do to sort of re-engineer a new plan, but fundamentally you've just got to start somewhere.
Yeah, I agree, and I think what you've just said there at the end is it's not only going to be beneficial for the patient to have these added extras basically to their routine examination, but it will also help make the day-to-day for the dentist, for the dental professional more exciting, which
more rewarding.
Yeah, exactly, and I think that's very important, and as we said at the beginning, perhaps one of the reasons why people do look to specialise is because they don't want to fall into a pattern of the same day after day. So if you can add this in, it will make maybe that side of dentistry a little bit more appealing to the dentists from school.
If we think back, to pre-pandemic, lots and lots of practices were maybe having 2 team days a year where they went and did some fun stuff.
Yeah.
Fun's sort of missing from the world a little bit at the minute.
Yeah.
I think that's stating the obvious, but get back to having those fun days, and if that means that you can't, if you look ahead now and you can't have one for 3 months, great. So book it in.
Yeah, for sure.
Do something fun. Be that if you want to go and you want to canoe down a river, if you want to go and have a spa day, but just look to do something fun as a team, because it's been a really rough 2 years, and people have got to recognise that, and dentists as leaders, that's part of their job, to recognise that it hasn't been a whole lot of fun for their teams either.
No,
and they're working in advanced PPE, they've got all their socks still, their waiting rooms aren't fully open. It's not the most pleasant environment in the world for fun.
No, it's not.
So I think what we've got to do is try and take the time, because at the end of the day, time is a currency, and you can only spend that once. We've got to stop firefighting and this constant thing of going into Monday morning and finishing on a Thursday, finishing a Friday, and it's seeming like a whirlwind. And we've just got to take that time back and say, right, we've got to stop, we've got to look at this, and we've got to see where we're going right, where we're going wrong, and what we can do more for each other as a team as well.
Yeah, absolutely. There's some really good stuff there that people can take away, so thank you very much for shedding a light on the realities of what's going on in Northern Ireland, and then the advice for those practices in any area, and how they can...
Well, hopefully we get some solutions to the workforce issues, and hopefully those patient needs and patient demands begin to subside slightly, which things go in cycles, and hopefully they do a little.
Yeah, that's what I keep telling myself as well.
Thanks, Gabby. Thanks a million. Cheers.
Thanks so much,
Bye-bye.
Gary. I appreciate it.